Welcome, everyone, to another edition of the Sports Medicine Update, a weekly podcast. Yours truly, Jerry Riles, and the Honorable Dr. Chad Prodromos. Doc, how are you?
Doing great, Jerry. Thanks. How about you?
I'm doing fantastic. I'm trying to get into the fall spirit. As you can see, I got a little gruff going there. And I got to say, it was a little bit by accident. I got a little bit lazy in the past couple of days. I say I'm not taking a razor to the old mug here. And now I'm getting a little bit of snowflake going on the chin. But it's in preparation for the fall and changing up the guard, so to speak. What do you think?
Hey, Jerry, I think you look stylish as hell. I mean, you're a good-looking guy, Jerry. You know, it's if you got it, you got it. I think it's great.
Well, I can tell you one thing that we have in this beautiful country called the great United States of America, and that, of course, is we got America's favorite pastime. That's baseball. The Cubs and Sox, congratulations to both of those teams. The White Sox advancing to the playoffs in a shortened 60-game season. The Cubs are knocking on the door, so hopefully we got some fall baseball, and we're looking forward to some championship baseball. But we got college football, and we got some National Football League football in the greatest country in the world. And I tell you, NBA basketball, the NHL playoffs. I mean, if sports fan, if you're a sports junkie, you're definitely in heaven, and you are certainly ecstatic. But of course, when we hit the real world and we talk about reality, Doc, with the era that we're living in, the culture that we're living in regarding coronavirus and COVID-19, we're all concerned about safety and protecting not only ourselves and our loved ones, but our peers and our neighbors. And the Big Ten, it was voted 11-3 a couple of weeks ago as far as should the players return to play. Three schools in the Big Ten said no, Ohio State being one of those teams. And this past weekend, it was decided that, yes, we're going to move forward and play football in the fall. So things are going to get started next week as far as practice is concerned, and then we'll start seeing some game action coming up in a matter of weeks. But what was your assessment after hearing what many of us say is the good news that, we got Big Ten college football back here in the Midwest? What was your reaction when you heard that?
Just like you, I think it's great news. They made a mistake canceling way early. And I give them all the credit in the world for having the guts to, in light of new information, reverse their mistake. There's no reason for them not to play. There's every reason for them to play. And, good old American system. The guys were, Jim Harbaugh was out there marching with his players, and they put pressure on them. And that's what you have to do. I don't think there's much impetus for the Pac-12 now, right? To get back, but all the credit in the world to the Big Ten.
Well, one of the big sticklers, Doctor, and we're Dr. Chad Prodromos Sports Medicine Update, the weekly podcast. One of the major sticklers was the long-term effects of coronavirus, and as far as we know on paper and with your expertise in the medical industry, it affects those who are, maybe mid to upper 60, 70 plus, who, if they, test positive for this, it could be very, very serious. We're now understanding that some of these young kids, in their 20s in particular, that they can test positive for it and have some side effects as well. But the jury was still out as far as long-term effects, down the road, how this virus can affect the immune system and the respiratory system. And that was the big sticking point. How do you address that? And do you have any numbers that you can say, hey, you know what? The study is still out. We're still not sure. Or, hey, we learned that it does not have a long-term effect.
Well, two things. Number one, I think there's no reason to think it'll have a long-term effect. Respiratory viruses just tend not to. And what can happen, there's been so much scrutiny that you can run into problems as were run into with the premature report of something like a third of the people getting myocarditis. So you see, there's a general situation in medicine where there is a disease state and there's a test that can be a surrogate for the disease state. Well, in this case, they got echocardiograms that seem to show inflammation, something like that. But you can't base medical decision making on, mildly abnormal lab tests. The example was brought up with that you can get echocardiograms on people that'll show what would otherwise be a cardiomyopathy, it's called, that in an athlete won't be. So the thing is, the doctor was at Penn State. Nobody at Penn State, at least last I checked, has gotten it. So if you're breathlessly looking for problems, you can look at lab tests, you can look at echoes, you can look at other things that seem to show some abnormality and then say, oh my gosh, this is terrible. But I think there's no evidence to think that there's going to be long-term effects. It's just generally, happens here and there, but it just generally doesn't happen. So unless and until, now you mentioned long-term effects, the truth of the matter is, the only way you can know if there's long-term effects is to do long-term studies. I mean, nobody's going to know what the 10-year problems with COVID are until 10 years from now.
Right.
But as right now, I think, and to say that people have involvements of other organ systems, well, if you get generalized inflammation, you can find tests that will show that. But to use that as a reason for people not to participate and say, all right, well, you got COVID, you had respiratory symptoms, digestive symptoms maybe, they went away, but now don't play, don't do things because you don't know. Maybe it's going to affect another organ system is not good clinical decision making. If people get symptoms, you support them. When they're done, you send them back. And you don't treat lab tests, you treat the totality of the patient. Mm-hmm. And, we mentioned before, as everybody knows the statistic, only about 5% of the people that die with COVID only have COVID. So older people, just a lot of older people have other problems, and they're clearly predisposed. But not many of these young people do. I mean, if they do, maybe they should think about not playing. We discussed the unfortunate case last week of the young gentleman who was listed at 6'3", 355. So if that's accurate, being that heavy in and of itself is a risk factor. Being heavy predisposes to other risk factors. I mentioned the case of Eddie Goldman on the Bears, who, at least from what I read, they said suffered from asthma. That's a risk factor. So, I think with football, because alone among the major men's sports, many of them are heavy, I think you have to be a little careful. But for the players that don't have risk factors, and the coach at LSU recently came out and said most of his players had it. For the ones that don't have risk factors, they want to play, they should be playing. They're safer in their bubbles. They're testing every day. They're far safer in that controlled environment. These are young, rambunctious kids. It's well known. One of the benefits of sports is you take kids, some of them get in trouble or have been in trouble, and sports gets them out of trouble. Idle hands, idle hands do the devil's work. That's how. Right. That's the aphorism. I hate to say these old aphorisms, but anyway, but it's true. So you take these kids, you test them, you give them a structured environment. If the ones have particularly high risk, maybe exclude them, and that's the safest possible thing for them. And risk-wise, overall, it's extremely low.
Yeah, it's interesting that you mentioned LSU, and I believe there were about 13 players that supposedly, allegedly came down, tested positive with the coronavirus. And I don't know if you recall, maybe early part of August, Boomer Esiason on his radio show on The Fan out of New York said that he had a couple sources that communicated to him that there were at least 3 major college programs that were encouraging their players to hang out together to get the virus so that the entire team can get it at one time they can get past it and they can move forward and get ready for the season. And I think LSU was one of those teams. Alabama, I believe, was a team, and maybe even Clemson. But those three powerhouse teams, allegedly, according to Boomer Esiason, were told by some assistant coaches, that it's okay if you do, get this virus and test positive for it, because and spread it to your teammates, because that means we'll all have it at once. Kind of like the chickenpox party that
Exactly.
you and I touched about. And now it seems like LSU have, the 13 players that have tested positive to that. Do you think that that's a smart approach to it based on what you know regarding the virus?